Stomach issues. This is a big issue in the disease. As time goes on, our clients, our folks become incontinent. First, it's usually of urine. Usually happens at night first. You start seeing it at home. We don't see it during the day, but as time goes on, we start to see it during the day, to the point where they're just totally incontinent. You can take them into the bathroom and sit them down and pick them up and take them out to the other room, and by the time you get them out to the other room, now they're gone. But they didn't go when they were on the toilet, so that's somebody who's totally incontinent. When later in the disease process, and it actually, we can make it happen to ourselves, but we don't, because it's not something that we want to have happen. I've always wondered, how in the world can somebody become impacted? My body tells me when I need to go to the bathroom, and off to the bathroom I go. And if I don't go, when it reminds me the first time, I'll go by the second time it says, okay, you need to go utilize the bathroom. Our folks don't get that signal doesn't work anymore. They may think of it, feel it the first time, feel it the second time. That signal doesn't come back again to remind them that they need to utilize the bathroom. So they hold it. And again, if we're not watching what they're doing, and they haven't had a bowel movement in 5 days, a whole bunch of things start to happen. Their little belly starts to get a little distended, hard as a rock. They might eat and regurgitate. Their breath smells foul. They can get very agitated. All these things can happen because they haven't gone to the bathroom. Now, I don't advocate giving someone like that, like a stool softener or anything, or kaopectate, because it can be, it's really plugged. There's no other word for it. They are plugged. They need to go to the doctor to have them physically remove the impaction. And it's not a pleasant process for the person. And if anyone has dealt with constipation in your life, you know how difficult it can be. Well, think about trying to get something out that is not going to come out. So really start being aware of, has that person gone to the bathroom? Our families come in all the time to the care club. We keep a list, because usually people that will have that problem aren't utilizing the bathroom on their own anymore. They need reminders. They need us to go in there with them. But it's really important to be aware of that this can happen. And once it happens, it seems like the person is kind of prone to it. So again, talking to the doctor, maybe getting stool softeners every few days if it's an issue for this person. But it's a real issue with some of our folks.
Couple prunes once in a while.
Couple prunes once in a while for some, but for some that just doesn't do it. Some of the big issues are they become more sedentary. They're not exercising as much. They're not drinking enough water. I don't know what it is, but water becomes this to our clients. We're constantly pushing water. They just don't want to drink it. That's all there is to it. And I think some of it comes from somewhere in the back of their mind. They remember, well, if I drink water, I'm going to have to get up and go to the bathroom at some point. So, and I hear some people who are in their right mind say, oh, can't drink too much water because it means I'll have to use the bathroom. Well, it's important to get all that stuff out. So, so watching for that stuff. And sometimes medications will cause it too. But it can become a real emergency, especially if people are eating and they can't keep it down because their system is so backed up. But normally, between the bad breath, because it really is bad breath, and the stomach distension, and you touch that stomach, it's as hard as a rock. And you can ask them if they've gone to the bathroom, and they're probably going to tell you yes, but they probably haven't. So being aware of that.
Ma'am?
Yep.
Another trick you can do to find out if your husband has a BM is to tell him not to flush the toilet.
Mm-hmm.
And that way you can always go and see.
Right. Most of them start forgetting to flush the toilet, which is okay because it does.
Yeah.
But there's also, in most places, a little lever on the back of the toilet where you turn the water off, and they can flush it. Once there's no water to flush it out. So, but most of them, because I think a lot of our folks, if you say don't flush the toilet, they're still going to flush the toilet. They're not going to remember not to flush it. But most of them at this stage usually aren't flushing the toilet. That's how we find out a lot of times that, you know, so-and-so had a bowel movement, and we can let the family know. And we do get those phone calls all the time. You know, mom hasn't gone at home in the last couple of days. Oh, well, she went here the other day. So they're not giving her unnecessary stool softeners and things like that. So now we're going to move to the other aspect, urinary tract issues. Urinary tract infections can kill people. And we have seen people come into the center, and if anyone has ever dealt with someone with a urinary tract infection, you'll know what I'm talking about. They walk in and they're fine. By the end of the day, we have them in a wheelchair. They're totally out there somewhere, not making any sense. They can't walk. You know something is terribly, terribly wrong with them. I get phone calls from families in the morning. I can't get so-and-so out of bed. They just are totally lethargic. Call 911, call the doctor, whatever. They need to go in and get checked out. These urinary tract, and I watched it happen with my own husband, and he has nothing wrong with him. We were out camping, we'd gone out to dinner, we went back to the campground. I was outside talking with our friends that were there. He didn't come back out of the camper. I went in and it's 90 some odd degrees outside. He's got on a sweatsuit. And I said, what is, he said, I'm freezing. I'm just freezing. And he seemed fine 45 minutes prior to that. So he would go to bed, and all night, up and down, he's up and down. I thought, oh, he's got a urinary tract infection. Well, we get up the next morning, and he doesn't want to get out of bed. He looks awful. Luckily, we had friends who could help me pick the camper up. We came back into Naples, because we were out in Clewiston somewhere. I took him into the hospital, and they admitted him for a week. He had a major urinary tract infection. He had to have IV antibiotics. He was what we call septic. The infection was so bad, it was throughout his whole body. And that's what happens to our people. We do not fool around with, and Rita and I talked about this the other day. She came in because she was concerned that she was seeing different depends on her husband and thought maybe he was having accidents and whatnot. And I said, no, he has a prostate issue and he leaks. When the staff take him into the bathroom, if that pad or someone's dirty, we change them. It's really important to change because that's part of what can cause the infections.
Is that the only way?
No, it can be, especially men who have prostate issues can get them just because they're not emptying they can't empty their bladder and the urine will build up and they can get it that way. And male urinary tract infections don't present like females do. Males usually, when it presents, they usually need to be in the hospital because it's much deeper inside of their body. Women, if you've ever had a urinary tract infection, you start the burning, all that discomfort. The men don't get any of that. Usually it's a change in their level of alertness. They become very confused. Sometimes they don't even have temperatures. If you can get a temperature on them, they look okay, but they're just acting really, really strange, like my husband was. So he was in for a week on IV antibiotics. Rita?
Lorraine, John had a urinary tract infection.
What's my name?
Lorraine.
She does it all the time. That's why I did that.
All the time. He had a urinary tract infection last year, and he was given antibiotics, and we went home. And 2 days later, we came back in, and the urinary tract infection had caused his heart rate to go up to 160 beats a minute. So he, who had never had any heart trouble ever, is now on medication for that. And it also caused him not to be able to swallow. He ended up in a nursing home because he couldn't swallow his food, and it presented a myriad of problems.
Exactly, yes. Urinary, and when we call families and say, we think they have a urinary tract infection, please call the doctor. Or if they're, we're having to put them in the wheelchair, we're saying, you need to take them to the emergency room now so that they can get them. Don't wait till Monday, don't give it a day or so because the infections just go wild. It's really, really quite scary. The other things that can cause it, Rita, are things like they don't wipe themselves as well anymore. So fecal matter can cause them to have urinary tract infections. So for women, that's a real issue. We all are taught to, wipe from the front to the back when we were little girls. Boys were never taught that. So husbands, if you're having to take care of your wife that way, wiping from the front to the back keeps that fecal matter from getting in and causing an infection. Now, if someone's incontinent and they're wearing, the Depends or the diapers, it's kind of there, so the chance of getting urinary tract infections is really great, and that's why it's so important. I know they're expensive, but to change them as much as possible, so that, it doesn't build up, the infection is being cleared out more frequently. And so, making sure that they're clean. Again, if you notice that they're starting to get these infections, it's because they're not cleaning themselves well enough. It means you have to take that job over and make sure that they're being clean so that these infections aren't happening. Now, there are some folks that we know that have chronic infection. It just never seems to go away. Unfortunately, they get put on antibiotics, which they need to have because you don't want the infection to worsen. And what's the side effect of antibiotics? Diarrhea. So now we've kind of got this happening. We've taken the antibiotic to stop the urinary tract infection, but the antibiotic is causing to have diarrhea, which can cause a urinary tract infection. So they're definitely more common in women, but men do get them. And like I said, they get them in a very different way than females do.